Thank you, Mr. Chair and Ranking Member Murray. And as is true for all of my colleagues, I think the topic of today's hearing is incredibly important, and I appreciate the chance to discuss it. I would venture to guess that just about every member of Congress has heard from their constituents about the rising cost of prescription drugs. I hear about it from Granite Staters all the time. But look, I also, right now, I'm hearing from Granite Staters all the time about Trumpcare and what the Senate is doing with Trumpcare. And Mr. Chair, I come from a state with a large citizen legislature, 424 volunteer legislators, where every single bill is required to get a hearing. You can't pass legislation in New Hampshire if the bill hasn't had a hearing. So I continue, I'm new to DC, but I continue to be amazed that we would talk about a bill that impacts so many people and a sixth of our economy. We hear references to it in the press. We know it's being worked on in secret, but we do not have even an outline of that bill for us to be able to examine ourselves or to get feedback from our constituents about, which is what the other purpose of having hearings is about, so people can see it and they can talk to us about it. And I appreciate this expert panel so much, but we have been talking today about the nuances of benefit plan design when, in fact, if Trumpcare passes, a whole lot of our constituents may not have a plan to begin with. So I join with my colleagues in being so frustrated that we are needing to spend time today when we want to be talking about the very important issue of access to life-saving prescription medications for our constituents, but we need to be talking about Trumpcare, because if Trumpcare passes in anything near the form that the House bill is in, and we're told that the Senate plan is similar to the House bill, this will be kind of an academic discussion for a whole lot of our constituents. So I will join with my colleagues in asking the majority party to please share their plan with us and to please include us in this and to have a hearing so that our country can collaborate and come together and find a way forward. One of the things that I am also very concerned about is that we are hearing that the Trumpcare plan will cut Medicaid. And I think a lot about the people who are covered by Medicaid in my state with long-term disabilities who don't have the physical capacity to actually take the medicine themselves. So we need nurses and licensed nursing assistants and home care workers who can actually help. And if Medicaid is slashed, again, access to prescription drug medicine for a lot of our constituents is an academic issue if there isn't somebody who can help them take it. So that's what I think we should be talking about in a companion hearing to this one, is the overall Trumpcare bill. I do have a couple of questions about some fundamental issues that affect drug pricing, because again, I appreciate the discussion about benefit plan design, but we're still talking about underlying costs that keep rising very quickly. As you know, and Dr. Anderson, we began to talk about it in one line of questioning, drug manufacturers often point to high research and development costs to justify high drug prices. But in December, Health and Human Services released a report that concluded drug manufacturers set prices to maximize profits. This finding is obvious, especially for those who struggle every day to afford their medications. But I want to point out something from this report that I find interesting and would ask for you to comment on it. The HHS report said that the relationship between research and development costs and drug prices is subject to a number of misconceptions. In reality, the prices charged for drugs are unrelated to the development costs. Drug manufacturers set prices to maximize profits. At the time of marketing, R&D costs have already occurred and do not affect the calculation of a profit-maximizing price. Dr. Anderson, your testimony echoes this finding, and I really am curious to find out from you as an expert in this field, do companies spend more on research and development or on marketing, advertising, and then add to it in the profits they take?
So thank you for the question. They spend more on research, less on research and more on marketing and sales on most of the companies. So, you know, essentially you're correct that there is no typical relationship between the amount invested in a particular drug and the price of that drug. Overall, the companies need the money for R&D, but they don't actually price on the basis of how much R&D they put into a particular drug.
Thank you very much for your answer. Thank you, Mr. Chair.